Empowering women's health. The importance of Pap smear for cervical cancer screening. Introduction. Cervical cancer remains a significant global health concern, affecting millions of women each year. However, with advances in medical technology and screening programs, cervical cancer is highly preventable and treatable, particularly with the widespread use of Pap smear tests. In this comprehensive guide, we delve into the importance of Pap smears for cervical cancer screening, their role in early detection, the procedure itself, and empowering women to take charge of their reproductive health. Understanding cervical cancer and its risk factors. Cervical cancer arises from abnormal changes in the cells of the cervix, primarily due to persistent infection with certain strains of the human papillomavirus, HPV. While HPV infection is common, not all infected women develop cervical cancer, as various factors influence disease progression. These factors include smoking, immunosuppression, early onset of sexual activity, multiple sexual partners, and lack of regular cervical cancer screening. The role of Pap smear in early detection. The Pap smear, also known as Pap test or cervical cytology, is a simple yet powerful screening tool used to detect precancerous or abnormal changes in the cells of the cervix. During a Pap smear, a healthcare provider collects cells from the cervix using a small brush or spatula. These cells are then examined under a microscope to identify any abnormal cellular changes indicative of cervical dysplasia or cancer. Importance of regular screening and prevention. Regular Pap smear screening is essential for early detection and prevention of cervical cancer. Guidelines recommend that women begin cervical cancer screening at the age of 21, regardless of sexual activity, and continue screening regularly until the age of 65. Screening intervals may vary based on individual risk factors and previous screening results. By detecting precancerous changes early, Pap smears enable timely intervention and treatment, reducing the risk of cervical cancer development. Procedure and preparation for Pap smear. Undergoing a Pap smear is a relatively simple and painless procedure that can be performed during a routine pelvic examination. Before the test, it's essential to communicate any concerns or discomfort with the healthcare provider. Patients are advised to avoid vaginal intercourse, douching, or using vaginal medications or contraceptives for at least 24 hours before the test, as these activities can affect the accuracy of the results. Interpreting Pap smear results. Interpreting Pap smear results involves classifying cellular changes according to standardized reporting systems, such as the Bethesda system. Results may indicate normal, atypical, or abnormal cellular changes, ranging from low-grade to high-grade squamous intraepithelial lesions, SIL, or cervical cancer. Depending on the findings, additional diagnostic tests or follow-up procedures, such as HPV testing or colposcopy, may be recommended. HPV testing and co-testing. In addition to Pap smear, HPV testing plays a complementary role in cervical cancer screening, particularly in women aged 30 and older. HPV testing detects the presence of high-risk HPV strains known to cause cervical cancer. Co-testing, which combines Pap smear and HPV testing, offers increased sensitivity for detecting precancerous lesions and guiding clinical management decisions. Addressing barriers to cervical cancer screening. Despite the effectiveness of Pap smear screening, barriers such as lack of awareness, access to healthcare services, cultural beliefs, and socioeconomic factors hinder widespread participation in cervical cancer screening programs. It's imperative to address these barriers through education, outreach initiatives, community-based interventions, and policy measures aimed at promoting equitable access to cervical cancer screening for all women. Empowering women's health through education and advocacy. Empowering women to prioritize their reproductive health and participate in cervical cancer screening programs is paramount. Education campaigns emphasizing the importance of Pap smears, debunking myths surrounding screening procedures, and promoting regular healthcare visits can empower women to take proactive steps in preventing cervical cancer. Moreover, advocating for policy initiatives that support comprehensive cervical cancer screening programs and HPV vaccination efforts can further reduce the burden of cervical cancer worldwide. Conclusion: Pap smear screening plays a crucial role in early detection and prevention of cervical cancer, offering women a powerful tool to safeguard their reproductive health. By undergoing regular screening, women can detect precancerous changes early, enabling timely intervention and reducing the risk of cervical cancer development. Through education, advocacy, and equitable access to screening services, we can empower women to take charge of their health and work towards eliminating cervical cancer as a public health threat.